providing multilingual health information. The words multilingual and health are in the title. It's a really good session, so I'm
It
excited.
is providing multilingual health information.
So I was right one of the 3 times I said it.
Yes.
We have just a couple minutes. We're going to go ahead and get started right on time. Yeah, this is a fun session today too. A lot of ideas.
Looks like it.
I know. Yeah, as you're coming in, if you have a chance to just put your name and where you're coming from in the chat, I'd love it.
I can kick us off just to get Stacy going here. Hi, I'm Ann Casti. I'm from Minitex, and we are a library service organization in Minnesota that connects all the libraries in Minnesota in a variety of ways through professional development offerings like this and through resource sharing and all sorts of fun stuff. We are thrilled to be able to host this consumer health for information for librarians series. Sorry, I didn't bring my notes. I thought I could just wing it today. But we are honored and thrilled to host Stacy and Catherine as they have done this third set. They are doing now the third session in our series. I will send you all an email when the recording is ready, and the handouts are on the series page, the registration page, and you can find that on our Minitex site. I'll send you information about that pretty soon too. So that's, I think, everything we need to set the stage. And I'll let you take it away, Stacy. Thank you.
Thank you, Anne. So hello, everyone. Welcome to Health Programming at Your Library. This is the third class in a series of consumer health information courses for library staff, sponsored by Minitex, as Anne said, and the Network of the National Libraries of Medicine, NNLM. So with me, I have Catherine Chu from the University of Minnesota Health Sciences Library. This week, she'll be monitoring the chat for attendees, and if you haven't already, please register for rural health resources, with which Catherine will be leading on November 7th. Also with us is Anne from Minitex, who'll be helping make sure everything runs smoothly. So a huge thanks to Anne, Minitex, and NNLM for making this series possible. My name is Stacy Hendren, and I use she, her pronouns. Since 2018, I've taken over 30 hours of consumer health information training and have level 2 specialization from the Medical Library Association. I've completed Train the Trainer training from NNLM, and Anoka County Libraries recently became a partner outreach program partner with me as the ambassador. I'm so excited about this topic and the consumer health specialization, as I've been able to implement consumer health information concepts into community partnerships, programming, and my reference work with the public. I'm also really excited to have you join me in gaining this expertise and supporting our communities throughout Minnesota and beyond. Please reach out if you have further questions after today's training. Just a few housekeeping items. Please locate and open the chat box. We'll be using this location for questions, and then we'll have specific time set aside to answer. We'll provide a link to the evaluation at the end of the session, which is your first step to claiming credit towards your Consumer Health Information Specialization, or CHIS. You can turn on the captions by clicking on the CC button at the bottom of your screen. And finally, we just want to make sure you're aware that all sessions will be recorded. Links to handouts, resources, and the recordings may be found on the Minitex series page the week after the event. Anne is super fast, so it'll probably be sooner, but managing expectations. If you missed any of the previous classes, I encourage you to go back. The recordings and handouts are already available. I also want to mention that there will be a lot of links in today's presentation. We'll do our best to put them in the chat, but all the links will be available in the handout with even more links so you can focus on the content not remembering web addresses. Okay. So briefly, NNLM is the network of the National Library of Medicine. It is the outreach program arm of the National Library of Medicine, which is one of the National Institutes of Health. NNLM is made up of 7 geographic regions. I'm an ambassador, as well as Catherine in Region 6. At NNLM, our mission is to provide equal access to biomedical information to health professionals, as well as access to quality health information for the general public, so they're better able to make informed decisions about their health. We do this through resources on our website, funding on projects, in-person trainings, and webinars, just like this one. And by partnering with great organizations to support health information access in their communities, in our communities. So when you think about health programming for your community, which picture most closely resembles how you feel? Please put the letter in the chat. So A is hands planting seeds in the dirt. B is a raft in white water. C is a large hedge maze. And D is a ballet dancer. If you're up for it, when you add your letter, please put a little note on why. So we all bring different feelings, experiences, and expectations about planning and implementing health programming in our communities. We hope to give you some information and resources to support you in this area. Catherine, are we seeing anything in the chat?
So far, most of them have been letter C.
C's. Okay, so that hedge mage. And I see there's so much, and finding the good stuff is a nugget. Thank you, Sarah, for adding that. So in this session, we'll discuss the purpose of conducting health programs for libraries, how to create a plan for the development and implementation of health programming in your library with ideas and examples from big to small, identifying potential partnerships for health programming and outreach in your library, and then identifying resources from the National Library of Medicine and other reputable agencies that can be used for support and implementation of health program in the libraries. So why might libraries conduct health programming and outreach? If you want to share something in the chat, please feel free. Some might say that libraries are trusted providers of information and community resources. Libraries have existing partnerships and hopefully local resources that are in tune with the needs of the community. I'm now a regular attendee at our local senior health fair, where I can provide reliable access to health information and resources, as well as information on opportunities that support brain health and reduce social isolation. Other reasons to offer health information in your community is that in today's complex information environment, we have a greater responsibility to communicate the resources and expertise that exist in our communities. Libraries, community centers, and faith-based organizations are often heavily utilized when someone has a question on just about any topic. They're often the starting points for information seeking on various topics, including health. And from the library's perspective, it also strengthens your image and visibility within your community. It's necessary to market libraries in a way that community members know what resources are available to them locally. It makes sense that if a library is regularly marketing its services, it will remain current in the types of services and resources that it provides. No one wants to promote outdated information. Also, by marketing your library, you will help to maintain relevance to your users, increase visibility, and inevitably show your overall value. If health outreach is new and programming are new to you in your library, it may be helpful for you to begin by locating information on your community's health needs. Oops, I went too fast. So again, that first step is knowing your community. And this is actually the first competency of the Consumer Health Information Specialization based on Finding Health and Wellness at the Library, a consumer health toolkit for library staff. Learning about the demographics, health issues, and challenges of a particular area can help you better meet the needs of your community, and programs that align with the needs of the community are most likely to be impactful. Also, Grant funders, like NNLM, require justification for funded program activities. So a quick aside, when I started my CHIS, one of the activities I completed was reviewing the Anoka County Community Health Assessment and Health Improvement Plan. So these plans are actually required by law for counties in Minnesota and for hospitals around the nation. So I compared the top 10 health concerns with the current offerings of my library to see where we excelled and where we could improve. And it was really exciting to see how much we were already doing. This is a tiny snippet of a much longer spreadsheet. So I really encourage you to seek out your community health assessments. Now I'm going to share 3 resources for finding quality health statistics. So I'm a firm believer that librarians and community advocates are uniquely in tune with the needs of their communities. But step 1 to planning health outreach is knowing where to find quality statistics to back up what you might already feel about your community. State Health Facts provides free, up-to-date, and easy-to-use health data for all 50 states, the District of Columbia, counties, territories, and other geographies. Data available on State Health Facts comes from a wide variety of public and private sources, including Kaiser Family Foundation reports, public websites, government surveys and reports, and private organizations. So for example, if you're interested in offering a program on diabetes, you can find information on health status indicators for your state on diabetes and information such as percentage of adults who have been told by a doctor that they have diabetes. So here's a graph I was able to put together quickly by searching for diabetes and then narrowing to Minnesota, North Dakota, and South Dakota to see statistics from my state and its neighbors. And based on this data, a programming targeting seniors and diabetes would be the most beneficial for my community. The second resource is the County Health Rankings and Roadmaps, a service from the Robert Wood Johnson Foundation, an excellent place to start looking for information about health issues in your community. I really like this one. How it's laid out and the variety of information available is really useful. And this program provides health data at the county level. You can choose your state and county, then scan through the data to get a sense of the information provided. And they have a really good just layout of general information, and then you can go deeper. So here's a snapshot of the county where I live and work. One category is health behaviors, and you can compare your county to the state and then US percentages. And near the top of the table, there's a checkbox for show areas to explore. Clicking the box will highlight any red flag areas in the county that are potential challenges to health. So in Anoka County, a top concern is adult smoking. So a simple way we address this is by providing brochures from public health about local smoking cessation resources. But there's other opportunities too. You can also find areas of strength, one of which in my area is high access to exercise opportunities. And my library contributes to that with items in our library of things, such as Nordic walking poles and snowshoes, as well as bike racks and a bike fix-it station at all of our branches, so that even those who maybe can't afford those extras have access. And then if libraries need to justify the need to purchase materials for a program on a given topic, you can use the county health rankings and roadmaps to locate information on your county and compare to other counties and demonstrate that there is an identified need to raise awareness on a given topic. So look up your county, then make a note of areas that stand out to you. The third and final resource is the City Health Dashboard, which allows you to see where the nation's 500 largest cities stand on 36 key measures of health and factors affecting health across 5 areas: health behaviors, social and economic factors, physical environment, health outcomes, and clinical care. These categories align with those used in the county health rankings and roadmaps. And while it is at the city level, I found it really interesting, like what's available for the bigger cities versus the smaller cities. So even if you don't think you're in the top 500, I encourage you to look for your area or look for your city and just see what's available. And then one metric I reviewed was broadband connection in Blaine, where I work. So in the top graph, you can see that Blaine has higher than average connectivity, but still over 15% are without access. The detailed table also shows with more specificity which areas have the least activity, with some areas having over 30% without access. So as we continue to expand our Wi-Fi hotspot program, this data can help us target the populations most in need. And, it took me a while to think broadband, how does that connect to health? But there's so many economic and social factors that impact health that this is one I found really interesting. Another benefit of the tool is you can examine dashboards by demographic area, comparing cities or metrics and tools for taking action. So before I jump into the planning and ideas, do we have any questions in the chat? Not yet. Okay. Now I'm excited because this is the fun part where we jump into ideas. Not that it isn't all fun. So there are many ways to incorporate health issues into library programming and outreach. Can you share an example that you've seen or conducted? Love to see that in the chat. One example of outreach is a library partnering with a local nonprofit to provide free menstrual products. Anoka County Libraries received a donation of period products from the National Council of Jewish Women in 2022. Or you might have programming for seniors about how to find reliable health information online. One Anoka County Library program titled Understanding Doctor Speak was especially well received. Looks like in the chat we have healthy snacks for student workers in the break room. I love that. I've been trying to get them to buy those for my library and they haven't yet. But we did get some like stretchy bands for our break room for exercise. There are a vast variety of programs you can offer to address the health needs of your community. So here are a few more categories to get you started. Ooh, and I just see health talks in partnership with our local hospital. Nice. So food access, pantries, cooking programming, gardening. 2 of our libraries received grants for Charlie Carts, which are mobile kitchens. And we do a lot of programs and partner with nonprofits to provide bags of food for those in need. Looks like Laura's had that program too, or similar. Movement, physical activity, walking, yoga, chair yoga, injury prevention. We have a walking book club at one of our branches. Access to care, vaccination clinics, diabetes education, smoking cessation, support groups, chronic disease management. Social work, embedded social workers. Technology, telehealth services, and digital literacy projects, children and families, sensory story time, music, movement, veterinary, vaccination, pet first aid, pet loss and grief programs. I'm hoping to someday partner with our local disaster pet rescue, which is part of Anoka County's emergency department. Promoting information and reference services or collections, curated lists of key or sensitive topics, local brochures, guides. So the pictures on this slide share a couple of examples. The Carnegie Library of Pittsburgh offers bookmarks to help teens find materials on sensitive topics without having to ask a library staff member. The Penn Hills Library has a food pantry. The Teen Hygiene Health Center at the Rockwood Makerspace in Oregon. And then Central New York Library Resources Council has a healthy pet project, including workshops on how to prepare for disasters with your pet. Catherine, are there any other ideas in the chat? If you want to share a couple?
We have yoga sessions. I want to be at the one that does the therapy animals. And then somebody else also does the flu shots as well.
Oh, nice. Great ideas. Some of you may already have an idea for the type of programming outreach you want to conduct, but if not, here's some more ideas. Or resources. Let's Move in Libraries has program ideas, resources, and examples of library programming focused around movement and active living, advice for where to begin, accessibility program, and information on liability. ALA's Programming Librarian, you can browse and search programming ideas, and it includes a search by budget, which is a great resource. Web Junction has a resource called Health Happens in Libraries. This is less a list of ideas and more dedicated resources for you to develop health programming, including webinars, communication ideas, detailed examples of projects. It's a deep resource and very much worth exploring to make your health programming a lighter lift for you. It also includes resources on things like sustainability, helping your library be autism ready, or creating a garden program for community pantry, and much more. Excuse me. There's also a rural health literacy toolkit, and it's a program clearinghouse specifically dedicated to rural libraries. Ready.gov has emergency preparedness training and programs, as well as a bunch of resources that you can request. And then Jayberry Storytime has a bunch of resources on food, movement, germs, and more to incorporate into story times with children. And then NNLM's past funded projects and currently funded projects describes target populations and projects that you can look at for inspiration or replication. And keep them in mind, we'll talk about it later, for funding for your ideas. So these are linked in your guide for today and give a wide variety of ideas because not everyone will be interested in the same types of programming. So I encourage you to explore the resources that are appealing to you to develop some ideas that might be a good fit for your community needs. NNLM also partnered with ALA for the library's Transform Health Literacy Toolkit. While the ALA Libraries Transform initiative has since been retired, the toolkit continues to provide key messages, program ideas, and downloadable marking materials, including bookmark templates and social media graphics for libraries to use as they promote health literacy throughout the year. The wide-ranging array of health literacy topics covered include nutrition, aging, and chronic illness. There are numerous resources available in the toolkit that will speak to the different types of health and other programming that you do in your library or community agency. And creating programs from scratch can be a lot of work. So I want to mention the National Library of Medicine produces traveling exhibitions, which are made available free of charge to public, university, and medical libraries, as well as cultural centers across the country. So mention in the chat if you have hosted or seen one of these on display, because I'm jealous because I really want one and I'm working on it. The traveling exhibition is comprised of banners, usually about 6, which contain information about their particular topic, but the main information is online. The banners provide an opportunity for programs or to highlight your services. And because there's so much online, even if you don't have the exhibit, you can access the resources. And then NLM has resources for how to create programming around the exhibit that you host. The exhibit that you see here is called For All the People, A Century of Citizen Action in Healthcare Reform, and it's also available in Spanish. There are online exhibitions enhanced by multidisciplinary education and career resources for educators and students in grade K-12 and in colleges and universities. This includes extensive lesson plans for multiple disciplines from history to science. So we can expand that public, school, and academic. And then there is a shipping fee for these, but contact your NNLM regional office to inquire about funding sources. I know Region 6 has funding specifically set aside to help with shipping fees. If you host a book club, consider exploring graphic medicine or a display. Graphic medicine combines visual storytelling and medicine, creating a unique opportunity for readers to experience and learn about healthcare experience through comics. Graphicmedicine.org is a great website with lots of resources to check out. And then there's also a National Library of Medicine graphic medicine exhibit, ill-conceived and well-drawn, with programs and the online exhibit connected. And it's about the use of comics and graphic novels as a form of communication about health. And then the University of Pittsburgh Health Sciences Library, as part of the exhibit, featured books and a drawing competition. So they invited a biologist and cartoonist to give a lunch and learn presentation. And then Region 7 developed a series of graphic medicine book discussion guides that are available on a variety of topics. If you live in Region 7, which is up in the area of the state of Maine, they also have a community of learning that you can join. But for us, if you're not, you can jump in and access those resources. NNLM has also developed an online health literacy toolkit to help busy library staff connect library materials that focus on or are related to health with a popular and familiar library program, the Book Club. The NNLM Reading Club is a curated list of health-themed books from a variety of genres to facilitate conversations on health and wellness topics. By reading different health topics in a safe setting, people can learn about health information and reduce the stigma surrounding some diseases and health conditions. And then included with each book is a discussion guide and free health information from the National Library of Medicine, as well as other trustworthy sources. They'll have interviews with the author, YouTube videos, as well as those trusted resources. So we encourage you to visit the Reading Club web pages to discover books, download discussion guides, and get the health conversation going in your communities. I've hosted 3 reading clubs so far, and there has been so much great discussion. In 2021, NNLM Region 5 funded 27 Collection Equity Outreach Awards to member organizations in the region that used the grants to purchase materials that supported the collection equity goals submitted in their applications. Each funded organization submitted a bibliography of purchased materials, and then these bibliographies were then used to compile the content for several collection development toolkits. So their hope is the toolkit would continue to help build collections that reflect voices of the communities served, enhance collection equity, and support health literacy by illuminating health issues facing underserved and underrepresented populations. Having materials on our shelves is a great way to support health programming and health outreach. So that was me throwing a ton of ideas and resources at you. Any questions at this moment?
There's no questions, but I do want to say 2 things. I just
Yeah.
want to mention that the ALA Programming Librarian, you can actually sign up for a monthly newsletter so that you can get ideas and whatever have you sent to you on a monthly basis. And 2, for the NNLM exhibitions, you can actually sign up also to be notified of when they're throwing out the registration or sign up for and what exhibitions are going to be sent out or available to reserve for, so that you can actually get on a sort of a mailing list for that. So whenever it comes out, so you don't miss something and you can look and see. Plus also, if you ever look at them, they've got some really fun ones. I don't know which ones are still circulating, but they have ones on Harry Potter and Frankenstein, so they have fun ones rather than some really dry health stuff. Just want to throw that out there.
Awesome. The one I'm interested is the mental health institution one. We had a former mental health institution in our county. And I think partnering with the Historical Society will be really exciting. Working on it. So once you've had a chance to review your community health needs and look over potential program ideas, you'll need to develop a plan. So it's often helpful to identify your target population, type of outreach or program you want to do. Are you sharing resources or doing a full-fledged program? And then determine what resources you already have available to continue with the plan. Remember, health outreach and health programming don't mean that you have to provide a 1-hour program with a speaker and activities. Think about your library or organization and what a manageable and meaningful activity might look like based on your staff, physical space, and other factors. One of our smallest libraries in the community just did a health fair at a local park. And so the county child and teen checkup came. They had a yoga instructor, and it was just a small activity, but it worked really well for their community with one of our smallest libraries. And it might be making information more accessible, such as brochures or those bookmarks. It might be offering one-time or ongoing program, or it might be offering some training. There are a lot of other options too. And then when making the case to offer health programming, I want you to consider the needs of your community, as we've been saying the whole time. And then in addition to your intuition and observations, gather evidence, knowing that administration, community leaders, and funders will expect evidence of need. It's easy to chase big, bold projects, but simple ideas and services are a really good place to start. And the simple question, is this project idea or program easy to explain to others? A few cautionaries. Avoid competitions, especially those focused around weight loss. And then know who you are inviting if you're inviting a speaker. If you're not familiar, multi-level marketing sales, MLMs, are businesses that use a non-salaried workforce to sell products to family and friends while recruiting others to do the same. So some MLMs are illegal pyramid schemes, and they sell supplements, diet plans, or unproven cures, and they may be interested in finding an audience or space in the library. And so when working with new partners, authors, and speakers, also consider a spectrum of ideas, opinions, and care. And so, for example, registered dietitians and nutritionists are not the same thing. Anyone can call themselves a nutritionist. A registered or licensed dietitian is a recognized medical professional who has passed a national exam. Furthermore, in the world of registered dietitian nutritionists, there's a spectrum from weight loss focused practice to healthy at any weight philosophy. So do your research when you're inviting someone into your building. Okay, delving a little bit more into planning. In order to think through the development of your activity, these are 7 questions you can ask yourself. They're all multifaceted, but will help you recognize what pieces you have in place and where you will need to fill the gaps. And the next 2 resources I'm going to show you are really beneficial regardless of the type of programming and outreach, not just for health. So who? Think about your target population, who in your organization can assist you, who in your community might be an expert or know an expert, and who are potential partners. What type of activity or program do you want to provide? Will you provide information or offer a program with a speaker? What resources are available from National Library of Medicine or other agencies that you can use? What are the community health needs, and what evidence of this do you have? When will you offer the program? When should you schedule it so your target population is available? Where will the program be held? Do you have the space? Could it be outreach to a senior center or school? Like I said, our small library couldn't have an event, so they were at a local park. Why? Why do you want to offer this outreach activity? Why will this benefit your library organization's chosen target population? How? How will you market the program? Are there specific locations where your target population frequents? How will you locate speakers if you're unaware of any? And then how much? This question involves looking at how much time you and other staff will have to invest in the activity, and also how much money will it cost. So that's a lot. And now I'm going to share another planning tool. If you need buy-in from funders or other stakeholders, one way to explain your program or activity is through the use of a logic model. I love logic models. They are so nerdily wonderful. I highly recommend them because they make the planning process easier and because they make justification easier. Any additional logic model users in the room, give a shout out in the chat. So a logic model is a visual representation of a program that illustrates how planned activities are linked to program results. A well-constructed logic model can make it easier to plan programs by helping you determine the resources and activities you need to achieve desired results. So as complicated as logic models may sound, they can be easy to use and very helpful from program idea to evaluation, or from intended outcome to idea. So at the very top is the goal of your activity or program. And then think about the inputs as the resource that will be used to support the activity or program you wish to conduct. The activities are the main things the project will do or provide. And then the outcomes are how many and what sort of observable, tangible results will be achieved. The short-term focus on what will occur as a direct result, such as changes in knowledge, skills, or attitudes. And the assumptions are the beliefs about the environment and community. External factors include the positive and negative influences, the cultural, economic, politics, and demographics of the community. And then both assumptions and external factors should be confirmed before implementing the program. At Anoka County, we include sections on equity considerations and a strategic goal connection. And one of the things I really love about the outcomes portion is a portion of your outcomes is going to be statistical. How many people came? How many people filled out the survey? How many people said that they liked the program? But then you're also going to have outcomes that are goals that you may not see the answer to. So if I'm doing that diabetes program I mentioned, one of my outcome goals may be to reduce the percentage of seniors with diabetes in the community. I'm not going to know the long-term answer, but knowing that that is part of the goal and the initiative will impact how I present it and how it's received or funded or supported. So this template shows the type of things you might include for each area. For example, your inputs include time, money, equipment. Your outputs might be that people have increased knowledge about evaluating health websites and that they then help their family members separate reliable information from questionable information. You're not going to necessarily be at their house seeing how they're doing that, but that's one of the outcomes that leads to why we are doing these programs in the first place. Both the blank logic model and information is available in the handout, and the link to the NLLM filled in information about logic models will also be linked. And then logic models don't have to be daunting. This is a simplified example for a children's story time from the Library Research Service. You can think of them a little bit like if-then statements. If we do have the things on the input side, then we predict the outcome side will happen. For this type of logic model, you can start with the goal and long-term outcomes, and then work your way back. If this way of planning appeals to you, there are many resources on developing logic models. It's also never too early to think about how you will market, promote the health program or activity. I'm sure many of you have had that experience where you work really hard on a program and one or nobody shows up. It's disheartening. But marketing is a way that we can try to improve those statisticals and that impact. So what agencies in the community does your target population frequent? What areas of your organization are your target population most likely to be in? It can sometimes be a process of trial and error to determine what marketing strategies work best for your community. Some ideas include the traditional use of flyers, newspaper ads, or signage on bulletin boards and in windows of local businesses. Additionally, information can be listed on website calendars, press releases on news feeds, and the use of social media sites. Remember, marketing doesn't mean you have to be restricted to the walls of your library. Place bookmarks in local health clinics. Have flyers about upcoming lecture series or database searching classes in a grocery store. Hair and nail salons, childcare centers, and community organizations in your neighborhood. I like to put them up at the local coffee shop. And everyone I've asked if I could put up a poster or a flyer has been so generous to the library. And then in a library setting, it might even be useful to place additional signs about the upcoming health outreach right in the stacks where the health materials are. This way you may catch a casual browser. And don't forget the power of word of mouth and the personal invitation. Make an effort to personally invite patrons to upcoming programs, and sometimes they even show up. A great resource I'll share is the Public Library Association's Marketing Strategies page, which includes a variety of resources to improve your marketing skills and get new ideas. With an idea in mind, begin to think about who you might be able to partner with to enable or enhance the outreach or programming activity. So partnerships. One effective way to do health programming is to partner with a local organization who needs a location or space and has goals that aligns with yours. And sometimes they reach a bigger population by coming to the library. Types of partnerships to consider: local government or public health offices, healthcare providers, food banks, agriculture nonprofits, cooperative extensions. They could do a program on food safety, local authors, businesses, or other health nonprofits. NNLM partners with a variety of organizations to offer projects, programs, and resources for libraries. Since 2003, StoryCorps has given over 600,000 people of all backgrounds and beliefs the chance to record interviews about their lives and preserve them in the Library of Congress. All Our Voices, Conversations about Health and Wellness, is a toolkit for libraries and community-centered storytelling. The toolkit includes programming tools, promotional materials, and more to support listening, sharing, and recording stories at the library. Citizen science and crowdsourcing is also a National Institute of Health priority area for the National Library of Medicine. So simply put, citizen science or community science is participation by the public to aid in real scientific research and discovery. NNLM develops resources with and conducts programming with SciStarter, an organization focused on advancing engagement from the public in research. SciStarter maintains a directory of projects that members of the public may contribute to: bird and insect counts, light pollution, animal behavior surveys, gamified research on Alzheimer's disease, and so much more. Since 2016, SciStarter has organized Citizen Science Month with NNLM and many other partners. Each April, librarians, scientists, facilitators, citizen science project leaders, and many others host events and programs that engage people from all walks of life in real science that matters to them. And then cite NNLM Wikipedia edit-a-thons. So Wikipedia is a starting point, sometimes the ending point, for information for a lot of people on all kinds of topics, including health. Wikipedia's health topic pages are visited a staggering 7 billion times a year, making it possibly the world's most popular health information resource. So the objective of Cite NNLM is to improve the credibility and content of medical and health-related articles on Wikipedia by adding citations and information from National Library of Medicine sources. So twice per year, NNLM staff virtually host Cite NLM Wikipedia editathons in an effort to make Wikipedia a better place and medical information resource. So you can participate or host your own event, even virtually. So even if you don't have a local partner, NNLM has partners that you can join to create programming for your community. And these events can build community, teach digital and health literacy and evaluation skills, and work to amplify stories. So one story, looks like you are playing. Okay, we're gonna go to the next slide because I don't know how to make the video not autoplay.
Stacy, it's not at least making any noise, so you could probably let it play while you're talking.
So you can't hear it?
I can't hear it. So
Okay. Thanks. So here's another example where community need was
Hot Springs, Texas, a rural community 90 miles north of
now it is apparently. Yeah, I'm sorry.
Okay. So what I'm going to mention, the video on the previous slide that Catherine put the YouTube channel in for is Pottsboro Library in Texas. It's a very small rural library. And when COVID hit, they stayed open for their community because there was nowhere else for people to go. And one of the questions they started getting asked was, do you have a way that I can meet with my doctor at your library? And so this was actually the first telehealth site in libraries. And they partnered with the local university and NNLM to get funding. And they have a special room specifically designed for telehealth. And so what I find exciting about that video is the idea that you know your community. And if you have an idea that you don't know how to fund, but you know would be impactful and is health related, connect with NNLM because they provide a variety of funding and opportunities, just like they did in Pottsboro. And I encourage you to watch the video. It's kind of a super heartwarming about libraries. So now we'll talk a little bit more about partnering with NNLM to design and implement health programs and resources in your library. So NNLM has a variety of resources to help design and implement health programs and resources in your library. Browse NNLM's curated collections that feature tools and programs and informational material from NLM, NIH, and other trusted sources of health information. Research data, outreach toolkits, training opportunities, and so much more. The Public Libraries Resource Guide is focused on health information needs in public libraries, including programming and collection information, though I would say it has information that's beneficial for all types of libraries. The Proposal Writing Toolkit has a lot of guidance, examples, and resources for grant writing. And they also offer a yearly webinar about how to apply for NNLM funding, regardless of your region. And then additional guides and toolkits include, but are not limited to, Black maternal health, emergency disaster preparedness, and grant proposal writing. There's downloadable print materials also available for order on many of their different products. NNLM also partners with other National Institute of Health initiatives to advocate for libraries as critical community partners when it comes to health and medicine. The NNLM All of Us Program Center is an example of this. NLM partners with the All of Us Research Program, which is creating the largest and most diverse health database of its kind by inviting at least 1 million people to participate in the program to better understand why people get sick or stay healthy. Okay. And then if you're not already, NNLM membership is always free. There's over 8,500 member organizations, libraries, schools, community organizations, and more. If your organization isn't a member yet, again, it's free, sign up, and it gives you access to so many resources. And then individuals can become members underneath their organizational membership. Throughout the year, we offer free trainings in a variety of formats, including on-demand and recorded webinars, so you can take them at your own convenience. Classes are always free, and then they're actually available for in-person trainings for staff at our organizations. And then community advocates, nurses, teachers, librarians are trusted among the public within their family, social circles, and work. So there's a wealth of inaccurate and downright predatory health information online. NLM maintains many social media pages to share their resources and combat dangerous health misinformation. So there's a lot of ways to connect with NIH, NLM, and NNLM. Choose the one that's right for you. And then I also want to remind you that the links and resources are available on the handout posted on the Minitex series page. So if you've explored the resource list, you'll also see additional resources about health equity and cultural humility. Before we can genuinely help and support our communities, we must understand their barriers and be aware that health access looks different for everyone. Also, many people who are different from us are entering our libraries, and cultural humility is a crucial way to engage with people meaningfully and kindly. Okay, so that is the main bulk of the health programming for the library, health programming at your library session. Now I'm going to transition and talking to the consumer health information specialization. At the beginning, I mentioned I have level 2 CHIS, and it has been a game changer for me at the reference desk in relation to providing health reference, programming, and partnership in my community. CHIS stands for Consumer Health Information Specialization. It's a program of the Medical Library Association that offers training in providing health information services to consumers and recognition for the accomplishments of acquiring new health information skills. With CHIS, you gain skills in these areas: understanding your community, health literacy, mental health resources, evaluating health information, and health equity. Minitex has set a goal for at least one individual in the 12 regional public library systems to complete the CHIS specialization, and we are hoping that staff from North Dakota, South Dakota, and academic or special libraries join us in that challenge. This fall, we have the 4 classes in this series, and in 2025, we're going to be hosting a cohort with the goal of collaboratively finishing the CHIS over a 12-month period. So watch your Minitex note for invitations to that cohort. So the application fee for the specialization is also covered by NNLM, which is a great benefit for our free NNLM membership. So this is an overview of getting the specialization. You earn 12 credits with the free credits through free classes, and you've just completed one class, 1 credit. Apply for the sponsorship, and then receive your NNLM sponsored consumer health specialization. So the evaluation is that first step to claiming your CE credit. So we have a QR code here, and we'll be adding the link in the chat. So after completing the evaluation, you'll receive the enrollment code, which allows you to claim credit from the Medical Library Association. And then you can visit nnlm.gov/training for additional courses and sign up for the newsletter to see what's coming up. So there's the evaluation link. Go ahead and click the link or scan that QR code. I'm going to quickly go to the next slide. So this is Catherine and my information. I encourage you to reach out if you have questions about the specialization. Go to the Minitex series website. Oh, Catherine, will you pop the Minitex site into the chat again? And then I'm going to go back to here. And we have a few minutes left for questions. Catherine, were there any other questions or ideas shared in the chat?
The only question was that, were we gonna be providing the links? And yes, and we put the Minitex site in there,
Okay,
so that should cover that. Otherwise,
great.
I don't think I saw any, questions.
Yeah, and so in the
Except for
you go to
somebody,
the Minitex site. I also want to mention the Minitex site has recordings of the videos. After watching the recordings, there will be the QR code will be in the recording so that you can get the link. If you do have problems with the links, feel free to reach out to me or Minitex, and I can get you that code if you had problems with that.
I do have one here that I don't know if you've seen it. Sarah's asking, is it possible to get the credit by watching the other two courses? I was unable to watch them live and had issues with the codes. So can you address that along with?
Yeah, and so that's what I was just saying. When you watch the video, it'll bring up the QR code. If you do have a problem with the QR code, go ahead and reach out to me or Catherine or Anne, and we'll be able to get you the direct link. And maybe I'll have Anne. Yeah, I don't want to just send out the link, but feel free to reach out to me and I will get it to you, Sarah, or others. Yeah. So I'm just going to mention, at the beginning, I showed the little bit of that spreadsheet where I went through and I looked at the top health priorities for Anoka County, and I was blown away by how many things we were doing. And it felt like doing a big health-related program needed to be the big thing, and we have done some. We did a 5-week, 10-hour positive psychology program, and that was pretty big, but there's so many little things that you can do.
There's Caitlin's asking a question. Have you ever struggled with providing access to information, but not offering your own medical advice to patrons with reference questions, or is that pretty easy after all of this CHIS training?
My confidence after the CHIS training skyrocketed. So at the beginning, I was very nervous about finding reliable health information. But again, the CHIS courses gave me a much more confidence in finding the reliable information as well as providing it to patrons. So one example, I had a patron come in, I was just diagnosed with this, and the doctor is going to be prescribing a drug. Can you tell me some of the common drugs that are prescribed for this? So I was able to go into Consumer Health Complete to find some recommended drugs. I was also able to look at Medline Plus, and I was very clear. I don't know what drug he's going to be recommending. These are some common drugs. And then he chose which ones that I printed. So I made sure I found the reliable resource and then helped the patron decide what to print. And so I would never call it like super easy, but I have no qualms taking on a medical health reference question now. And before, there was definitely the, little bit of deer headlights. I'm a librarian. I know how to do this. I can do this. Okay. Whereas now I have a lot more confidence. Catherine, anything to add?
Yeah, coming from a more medical setting in an academic setting, used to get a lot of questions from people who would try to push you to give you a medical diagnosis, and you can tell them, okay, I can look up the information for you and I can give you the information, but you really need to talk to your healthcare provider. And that's the sort of theme, is that when they push on it, you say, you keep saying, I am not a medical professional. I can find you information. I can provide you with this information, but you really need to talk to your healthcare provider. And that's the best way, just keep pushing back on that particular type of thing.
Right. And if you haven't seen last week's webinar, Catherine gives some really great resources for that health literacy, health information reference resource. Okay. Well, if there aren't any final questions, I really just want to thank everyone for coming today. Encourage you to sign up for the rural health resources or go back and watch the videos. I'm going to go to the last slide again so you can grab our contact information if you'd like. And thank you and have a wonderful day.
Oh, and if you happen to be attending MLA, the two of us are going to be doing another similar one of this one there too as well.
Yes, and I think I
Hey,
saw Nicole
like-
Miller. I think I saw Nicole Miller in the room. She is also doing a health-related presentation on her programming. So good luck to you, Nicole, and want to promote that one as well.
And thanks all for attending.
Yeah. So I was really worried about like